The complete guide to acids in skincare. Acids might initially sound intimidating, particularly if you have sensitive skin. Acids may at first seem scary, but properly formulated acids tackle a variety of issues, such as dark spots, discoloration, fine lines, and more. To identify the best acids for your skin type and issues, keep watching to learn everything there is to know about acids. Acids ought to be a part of every person's skincare routine. They differ in function and skin benefits due to differences in their structure, size, and chemical content. In order to help anyone to choose acids best suited to their skin condition, we will break down a few acids by structure, explaining how it determines the function and therapeutic application. Skincare acids go beyond just exfoliation. Each acid has additional benefits such as antibacterial, antiglycation, comedolatic, and anti-inflammatory properties. Acids also help lower the pH of your skin, which is naturally acidic. Studies have also shown that lowering the pH of your stratum corneum enhances bioprocesses and can help with your skin's innate immunity and microbiome. Acidic pH treatments, such as the use of topical acids, enhance barrier recovery, improve stratum corneum cohesion, and improve skin hydration. The stratum corneum is a natural barrier made up of intercellular lipids that are organized in continuous lamellar bilayers. This prevents charged, hydrophilic, and large species from moving, favoring uncharged, hydrophobic, and small molecules. This is important when diving into acids, because the structure of the molecule and the pH of the formula will determine the size, charge, and hydrophilicity. Every acid has an innate pKa, which is the point at which half of the molecules have their hydrogen ion and uncharged, while the other half do not have their hydrogen ion and charged. This pKa is unique to each acid and is determined by the strength of the bond that holds the hydrogen ion to the acid. Alpha hydroxy acids. The alpha or adjacent carbon of the carboxyl group contains a hydroxyl or OH group. These acids function as keratolytic agents, softening and loosening the stratum corneum's upper layers to promote shedding. One proposed mechanism involves the chelation of calcium ions, which are needed for cellular adhesion. AHAs work together just to reveal smoother, brighter, and younger-looking skin. Glycolic acid, lactic acid, mandelic acid, tartaric acid, and malic acid are examples of common AHAs. Lactic acid is an alpha hydroxy acid that's also known for its gentle exfoliation and skin smoothing properties. As it has a larger molecule than glycolic acid, it penetrates the skin less profoundly and thus causes less irritation. Lactic acid has been shown to be effective in the treatment of photoaging, hyperpigmentation and dark spots, dry skin, and mild breakouts. Mandelic acid. Mandelic acid is an aromatic alpha hydroxy acid, making it more lipophilic or oil-soluble than other AHAs, meaning it penetrates pores easier. On the other hand, it has a molecular weight, twice that of glycolic acid, 152 daltons, so it penetrates the skin more slowly. One study shows that mandelic acid increases sebum production, making it great for those with dry skin. The mechanisms of this acid are not all known, but it is known that it strengthens and supports collagen production, inhibits tyrosinase, and has antibacterial and anti-inflammatory properties. Mandelic acid reduces blemishes and congestion, especially inflammatory congestion, while addressing discoloration, fine lines and wrinkles, and skin elasticity. Glycolic acid. Glycolic acid is the smallest alpha hydroxy acid, weighing approximately 76 daltons. Because of its low molecular weight, it acts on both the epidermal and dermal layers of the skin, increasing collagen and hyaluronic acid synthesis. It also regulates matrix degradation and increases epidermal thickness in photoaging. When formulated below pH 4.00, it has antibacterial properties and brightens skin by increasing cell turnover as well as acting as a tyrosinase inhibitor. Glycolic acid improves fine lines and wrinkles, restores skin elasticity and vitality, fades spots and imperfections, evens skin texture and tone, and improves skin radiance. Beta hydroxy acids. Beta-hydroxy acids have a hydroxyl or OH group on the beta carbon or 2 carbons down from the carboxyl group. Although citric acid can be seen as both an alpha-hydroxy acid and a beta-hydroxy acid, salicylic acid is the only skincare acid, commonly referred to as a beta-hydroxy acid. This beta-hydroxy acid shares similar benefits with alpha-hydroxy acids, including exfoliation, reduction in hyperpigmentation, and evening of skin texture. Salicylic acid, like mandelic acid, contains an aromatic benzene ring, but it is less water-soluble. Salicylic acid's hydrophobicity allows it to work inside the pores, clearing excess sebum and debris, resulting in less skin congestion and potentially smaller pores. It also means that the exfoliation of salicylic acid is not as pH-dependent as that of alpha-hydroxy acids. This benzene ring also aids salicylic acid in inhibiting UVB-induced sunburn cell formation, preventing skin UV sensitivity, as seen with alpha-hydroxy acids. Polyhydroxy acids. Polyhydroxy acids have 2 or more hydroxyl or OH groups on the molecule, as the prefix poly means many. Polyhydroxy acids are considered second-generation AHAs because one of the hydroxyl groups is on the alpha carbon, giving PHAs similar skin benefits to AHAs, but with some added benefits. Because PHAs are larger molecules than AHAs, they penetrate more slowly and cause less irritation in those with sensitive skin. The numerous hydroxyl groups attract water as well, providing additional moisturization. Their antioxidant properties aid in the prevention of oxidative damage caused by UV exposure as well as the fight against glycation, sugar-induced sallowness, and skin sagging. PHAs improve skin barrier function and can boost the therapeutic benefits of other active ingredients. Lactobionic acid is a polyhydroxy bionic acid, which is a PHA attached to a sugar molecule, whereas gluconolactone is a polyhydroxy acid. Gluconolactone and lactobionic acid do not exfoliate as well as traditional AHAs, but they have additional benefits and are a good starting point for those who have never used acids before. AZELAIC acid. AZELAIC acid is a dicarboxylic acid, which means it has 2 carboxyl functional groups, one on each side of the carbon chain. It lacks hydroxyl or OH groups along the carbon chain, as do AHAs and BHAs. Azelaic acid is a skin-balancing ingredient that addresses overreacting bioprocesses in the skin and restores them to normal. This skin normalizer reduces hyperpigmentation while leaving normal pigmentation alone, normalizes cell turnover, and reduces blemishes while leaving sebum production alone. It is a gentler exfoliant due to its high molecular weight and actually reduces skin sensitivity by reducing pro-inflammatory agents and acting as an antioxidant. Azelaic acid has comedolatic and antimicrobial properties that help to treat blemishes while having little impact on the skin's natural microflora. It is commonly used to treat both acne and rosacea. 12 Azelaic acid reduces bumps and even skin texture, improves hyperpigmentation, reduces redness and inflammation, fades post-acne marks, and both treats and prevents skin congestion. Potassium azelaic diglycinate, an azelaic acid derivative, combines the benefits of azelaic acid and glycine, in addition to normalizing sebum production. TRANEXAMIC acid. TRANEXAMIC acid is a monocarboxylic acid, structurally similar to the amino acid lysine. TRANEXAMIC acid originates from the medical field and is used orally to reduce excessive bleeding. Topically, it is a potent skin brightener, normalizing pigment abnormalities such as melasma, post-inflammatory hyperpigmentation, UV-induced discoloration, and acne scarring. TRANEXAMIC acid acts as both a competitive tyrosinase inhibitor, as well as a plasmin inhibitor, addressing 2 different mechanisms in melanogenesis or pigment production. It pairs well with kojic acid. Kojic acid is a pyrone, known for chelating or binding metals, and does not fall into the carboxylic acid family. It is a pyrone containing a 6-member ring with an oxygen and ketone group. Kojic acid acts as a tyrosinase inhibitor by chelating copper ions essential to melanogenesis. Finally, acids can easily be incorporated into any skincare regimen. They work on all skin types,